very pleased to be here, Minister, Commissioner, colleagues, ladies and gentlemen. So I think, first of all, I would like to congratulate Lithuania to organize this conference on such an important issue as antimicrobial resistance. In my short talk, I would like to just, and there are a lot of data already known, but I think it's good to repeat some data, to be clear a way that we all understand the challenge in front of us. Then I would like to speak about evaluation we did of the action plan, and then look to the future and the ideas for a new action plan from the European Commission. As we said, antimicrobial resistance is a natural phenomenon, but over time it has been use, misuse, overuse, but also through different various routes AMR has spread. And it was already said that annually 25,000 people die every year due to the inability to treat bacterial infections. On top of that, we have also a huge budget impact, financial impact, because when you look at annually, 1.5 billion euro is spent due to prolonged stay in hospitals and also productivity losses. More data will become available in the future, but it's already clear that there is a clear link between, on the one hand, the use of antibiotics and resistance. And you will see in this graph with some not only European countries, but you will see that there is this clear link, and this link will become more clear if more scientific evidence based on surveillance and monitoring becomes available. Another important element not to forget is that development of new antimicrobials is very low. I think the last class of antimicrobials was found in the late 80s. So since then, no new antimicrobials have been developed. It was already said, annually, at a global level, we speak about 700,000 deaths a year. And if you put this if the current level of antimicrobial resistance would persist, then we speak about 10 billion in 2050. So in 2011, the Commission adopted this EC action plan. And I think that the main topics of this action plan was a 5-year action plan, but most importantly, it approached it with a One Health approach. And one of the issues, because antimicrobial resistance is nothing new, I remember studying veterinary studies, already then we studied antimicrobial resistance, and it's a long time ago, but it was because it was still seen as a sort of, the fault is with the veterinarians, all the fault is with the medical. The action plan really pushed forward for this One Health approach, that both sectors should play their role and act. The action plan was also about 7 key areas and 12 concrete actions, speaking about appropriate use, prevention of infections, new antibiotics, surveillance, and then a sort combined international research and innovation and communication. Now this 5-year action plan has come to an end, and the Commission, in order to decide on the future, the Commission launched an evaluation. And in a few slides I would like to point out the main achievements, but also the recommendations made in this evaluation, which was recently published by the European Commission. First main findings was that the actions which were in the action plan in 2011 are still valid. They were good and to address the problems, but they are still relevant today. A second important element was that the action plan was acted as a symbol of political commitment. If we see now, since 2011, what happened at EU level, but also at international level, we see it has risen to the top of the political agenda. My commissioner already mentioned the UNGA. I think it's in the history of UN, it's the 4th time that the public health issue has went up until the UN level, where all political leaders discussed and made strong commitments on addressing antimicrobial resistance. The action plan also provided a framework to guide and coordinate activities at international level, including relating to monitoring, surveillance, and research and development. And the actions were also taking into account the competences of the EU and national authorities when we speak about on the veterinary side, but also on the public health side. The recommendations made on this finding was that AMR problem is persisting and there is continued action needed. If we look to the human health aspects, the main achievements was that the Council recommendation on prudent use, that we now see that 21 member states, EU and EEA member states, have a national action plan which focus specifically on prudent use, including also education, training for healthcare professionals, but also communication towards the public. The Commission Council recommendation of patient safety of 2009 has now resulted that 29 EU and EEA member states have national guidelines for infection prevention and controls. And 13 of those member states have all specific rules in case of cross-border transfer of patients coming from another member state and finding some resistance to inform the other member states of these findings. The number of participating countries in the European Antibiotics Awareness Day have risen since 2008 up to 43 in 2013. And we see that half of those countries clearly said that it has an impact on the overall perspective towards antimicrobial use in their countries. The recommendation made by the evaluation was that a lot has been achieved, but there is still the need to support and assist member states because we still see huge differences between the member states. And if you see on the bottom, you see that, and again, as I said, it's a global issue. We don't want to focus only on the EU, but we see clearly that there is still, on the one hand, for example, you see Greece and Italy, and on the other hand, you see Germany and the Netherlands, where you still see a big difference on the use of antimicrobials in the EU. On the animal health, their main achievements have been made. My commission already mentioned the veterinary medicines discussion ongoing, the medicated feed, which will tackle specific issues on AMR. I refer, for example, for the veterinary medicines is about labeling, advertisement of antimicrobial, of drugs, of antibiotics. Speak about to put a legal framework for the monitoring of the use of antibiotics. Also, the other issues which are tackled is the use of certain, or reserve the use of certain critical important antibiotics only for humans. So this legal framework will be specifically target important issues relating to AMR. On top of course, the purpose of this is to have robust, solid veterinary medicines. On the medicated feed, we have also specific provisions. One of the provisions is, for example, relating to the prescription of medicated feed. We all know that antibiotics in farms often goes through medicated feed. So it's very important that prescription is foreseen and should be continued to be used based by the veterinarian for the animals under his supervision. Second important element is the animal health regulation, which was adopted, and now we're in the phase of developing, implementing and delegated acts. And one of the issues there is responsibility of the farmer, but also biosecurity. Biosecurity is a key element of the animal health regulation, which clearly is specific to reduce the infection pressure and by definition, of course, to reduce the use of antibiotics. And third, but not last, is the main achievement we made in 2013 relating to monitoring. We have now in EU a monitoring system which allows to identify, of course, the antimicrobial resistance, and more data will become available annually. But the more important is that this will allow to compare the data in the human sector. What happened in past, monitoring is not new, but there was different in methods used or the methodology. So now we have, and this was jointly made on EFSA advice with ECDC, that we have the scientific, robust criteria to monitor. And these monitoring data we can use to compare and to see the link between, on the one hand, AMR in animals and AMR in humans, and vice versa. So the recommendations made by the evaluation was, again, that more is needed. If we see the graph on this side, and perhaps no, it's quite small, but I can congratulate Lithuania, because you are very well placed in this graph when you see from the member states which have, because this gives the number of the use of antibiotics for 1 kilo of meat in 2014. And this comes from the recently published SFAC report about by Emma. So here you see clearly that there is still a huge difference for the production of 1 kilo of meat between some member states and other member states. So here again, more work is needed to tackle this issue. Coming now to the international cooperation. It's a very important element, and main achievement was that at WHO, the global standards on AMR are developed, and the EU reference laboratory on AMR is contributing to the work linked to foodborne zoonotic pathogens, but also looking to and helping this working group looking specifically on surveillance, which is known as AGISAR. EU, WHO, and ACP countries In this framework of this partnership, the European Commission invested 10 million euro specifically addressed to those countries in order to the veterinary medicine, to have qualified access to medicines, but also within this framework, in the framework of improving medicines selection and prescribing and dispensing, also some of those countries have all specific issues relating to antimicrobial resistance. At OIE, Animal Health World Assembly is clearly also looking at the global database, and the Commission is actively contributing in helping to develop further this database in order to collect data not only from Europe but also across the globe about the use of antibiotics in the animal farming. And then last, it was mentioned, TATFAR. TATFAR, there is a very good cooperation, and this now is renewed for another 5 years, last year in September, another 5 years to work together, US, EU, and was now joined by Canada and Norway to exchange information and to understand and to exchange good practices and development of peer relationships. So the recommendations made by the evaluation was that, again, giving the cross-border nature, and I think we all agree that there is the need of a strong EU voice at international level and remains necessary into the future. And then last is about research and development. Research and development achievements have been made also over the 5 years. We have the joint program initiative, which gives the purpose of this is to coordinate between the different activities within the different member states in order to see that there is no overlapping in research. And this now, is now joined by 22 countries. 22 countries have developed this strategic research agenda in order to better coordinate and to see that when research is done, that they are not competing, but that they are adding value. So in order to be sure that the money is well spent and that we all work together in this research area. Under the Innovative Medicines Initiative, there was a new program launched, about 650 million, which is called New Drugs for Bad Bugs, which is a project which is specifically tackling development of antibiotics, but not only developing antibiotics, but also the whole chain, also including new business models. So this project, now currently under this program, 7 projects are running specifically looking to this issue. A third important achievement is what we call the InnovFin, and this is a specific loan given by, and this is the main, it's a financial instruments which, and mainly for SMEs, is to provide them loans in order to further develop innovative approaches relating to tackling infectious diseases. One of the key issues identified was that sometimes the financing for the small SMEs are very limited and they don't have the big funds. So this project, this InnovFin, will help by a loan, will help them to further develop and to work on their sometimes very innovative and very challenging but very interesting developments. And then last, there is under the Horizon 2020, a specific prize is dedicated now under the better use of antibiotics, and prize will be the prize which will be now for the first time rewarded is linked to specific rapid diagnostics linked to upper respiratory tract infections. So the recommendations made by the evaluation was that coordination, continued coordination and cooperation is needed, but the importance, and this is very important, the importance to look at more alternative treatments, vaccines, rapid diagnostic tests, and new antimicrobials. So a part of the evaluation, and this is more linked to the communication, another important source of data became available due to the recent Eurobarometer that the Commission launched in 2016. And just going to some key findings was that, in compared to the surveillance we did in 2013, is that a third of the EU citizens have taken antibiotics in the last 12 months, and this is little change since 2013. We see that the knowledge has remained constant, but we also see that for some countries it has been increased, for some countries, unfortunately, it has been decreased. Of course, we also see that for those consumers, patients, having received information, that they have an impact on their use. So the communication towards the patients, towards the citizens, is quite important because it has an impact. And last, is that 35 of the Europeans clearly expressed the need of global and EU actions when tackling AMR. So based on all these elements, the Commission has now decided, and I have to say, speared by my Commissioner Andriukaitis, has now agreed to have a new action plan. And this new action plan, of course, this will be developed and will be published as a communication of the Commission by the middle of 2017. But it will be scaled around three main pillars. The first pillar is making the EU a best practice region. Not because we are the best, but we have enough knowledge, we have our scientific bodies, we have a lot of experience. So we want to use this experience in order to help member states to develop their national action plans, which all member states have signed to have by mid-2017, according to WHO, a national action plan. We want to strengthen the surveillance and the monitoring. We want to push and further make it more robust. And we want to also increase public awareness on AMR. And then I refer to the results of the Eurobarometer. Still, some work has to be done, not only by you, but also by the member states, all involved, in order to push for this awareness. Second pillar is about research and innovation. Further, we have to look not only to new antibiotics, but we have to look to new business models, incentives for investments, but also looking to alternatives, rapid diagnostics, vaccines, because one of the key elements in all the discussions over now the 5 years of the action plan was that we need to have rapid diagnostics. We need to have diagnostics which allow both the veterinarian but also the doctor to identify immediately, do we need antibiotics first, and if we need antibiotics, which antibiotic? Do we always have to be broad spectrum? Perhaps we can use with a small spectrum with this rapid. So rapid diagnostic tests is a key element for the future, and hopefully that research can be boosted in this direction in order to have solid, good rapid diagnostics which are affordable and giving, as the word says, rapid results. And then last but not least is the global action. A lot has been done already. We have done on G7, G20, UNGA, but here we want to continue partnering with our experience, with our knowledge, together with the member states at WHO, OIE and FAO level. And we will support third countries. We will have regional approaches. As we said, we will go to South America in the beginning of next year, where we will have conferences on AMR and have workshops additional to help those countries also to boost and to compare and to understand and exchange information and approaches. And of course, we will pursue the high-level political commitments, because a key element in this dossier that the high political commitment remains, both at UN, G7 and G20. And I thank you.